dear viewers, welcome you all to our show OSA, that is the Orthopaedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today we are going to discuss a topic that is the Ischaemic Disease in lower limb, treated by Ilizarov. A very magnificent topic, as well as a very challenging topic also. And the speaker is the one and only, the magnificent presenter, Professor Mofakhkharul Bari, sir. I would like to request Professor Mofakhkharul Bari, sir, to join with us.
Thank you, Tanvir, for introducing me.
Thank you very much, sir. Dear viewers, we have 4 learned academic experts with us. One of them is Professor Novikov, sir, from Kurgan, Russia, and another one is Professor Manish, Dhawan, sir, from Sir Gangaram Hospital, Delhi. I would like to request Professor Manish, Dhawan, sir, to join with us. Sir, good afternoon.
Thank you.
Thank you very much, sir. And another one is Dr. Shamsul Hoda, sir, from Patna, India. I'd like to request Dr. Shamsul Hoda, sir, to join with us. So welcome.
Good afternoon, Dr. Tanvir. Thank you.
Good afternoon. Dear viewers, we have another academic expert from Mauritius. That is Dr. Indraduth Chunnoo. I hope Professor Novikov, sir, and Professor Indraduth Chunnoo, sir. Yes, we got Professor Indraduth Chunnoo, sir, with us. Sir, welcome. Welcome to our show, Orthopaedic Solution Academy. I would like to request Professor Indraduth Chunnoo, sir, from Mauritius to join with us. Sir, can you hear me, sir?
Yes, sir. Thank you very much. I can hear you.
Thank you very much. So we can hear you loudly and clearly. Dear viewers, we hope Professor Novikov, sir, will join with us in the coming part of our program. Dear viewers, we all know that the ischemic disease in lower limb is a very challenging disease for orthopedic surgeon. And we all know that we can treat it by Ilizarov. But how it is possible? We'll discuss it in our topic today. Now, I'd like to request Professor Mofakhkharul Bari, sir, to start his magnificent presentation. I'd like to request Professor Mofakhkharul Bari, sir, to share his screen with us. Sir, would you please share your screen with us?
Yes, I'm going to share my screen now. Can you see my screen now?
Yes, sir, we can see, sir.
You can see, yeah? It's okay. Now I can start. My dear friends, and especially my new friend here, long time I know him, Dr. Indraduth Chunnoo for Mauritius, Professor Manish Dhawan, Professor Novikov, Shamsul, and Tanvir, and my viewers. Today I'm going to talk on the very interesting topic that is called the wire technique for ischemic diseases of the lower limbs. Before that, I talked for the last 2 weeks regarding the TAO and at the same time diabetic foot ulcer. So these are my centers. I always love to show these. My Kiev, Tashkent, and Kurgan center. Our very big institute, 1,000 bedded in Dhaka, Trauma and Orthopedic Hospital. This is my working place, and 2 hospitals, very big in the Southeast Asia. And this is my center. And this is, I also love to show this one also. And the Professor Ilizarov, 4M, man, meat, method, and magician. He is the orthopedic miracle of the nature. So now, today, I would like to remember this gentleman, Professor Shigirov. You can see here with me, day before, is on 6th of this month, he died. He was a fantastic teacher, very gentle, very polite, very sober. So I always remember this gentleman. I learned a lot of things from this Professor Veniamin Maximovich Shigirov. He died on 6th of this month. Most of the Ilizarov surgeons in the world, they are the students of the Professor Shigirov, including the Dror Pale, you know. So we are happy that in my country, we're doing a lot of opportunity, and we had got a lot of opportunities to showcase our talent. The Ilizarov technique is indeed like a mathematical formula, which is infinite variations. It can be used in many clinical settings frequently when nothing else can be done. Now, I would like to talk on the CLI, that is critical limb ischemia, the reduced blood flow in the arteries of the lower extremities. TAO, or severe occlusive arterial disease, who did not respond to previous non-surgical and surgical treatment and had chronic critical ischemia in the lower limbs. The treatment experience of diabetic foot ulcer with transverse tibial transport was carried out by Ilizarov technique to induce formation of new vascularity. Modular foot ulcer is not a common condition. It disturbs the daily activities of the patient. TTT, that is, I told you last Friday, tibial transverse transport corticotomy induces the formation of new vascularity. Pain, swelling with multiple nodules, discharging sinus, and discoloration of its skin are the main cause or the main things in the affected limbs. So, if you think about this 2020, 165 cases, among these TAO, thromboangiitis obliterans 24, limb ischemia 4, diabetic foot ulcer 58, and Charcot arthroneuropathy 54, myxoma pedis 1, and post-traumatic infected sole and dorsal of the foot 24. Critical limb ischemia is the reduced blood flow in the arteries, the lower extremities. It is a serious form of peripheral arterial disease or PAD, but less common than claudication. Critical limb ischemia is the advanced stage of peripheral arterial disease, which results from a progressive thickening of any arteries lining caused by buildup of plaque. What is the limb-threatening ischemia? Limb-threatening ischemia, also referred to as critical limb ischemia, and the limb thread is an advanced stage of peripheral arterial disease. It is defined as a triad of ischemic rest pain, arterial insufficiency ulcers, and at the same time gangrene of the affected part. What are the 5 P's? You know all these things: pain, paresthesia, paralysis, pulselessness, and poikilothermia. And what are the 6 P's? The classical description of the patients with the acute limb ischemia is presented by 6 P's. These are pain, pallor, paralysis, pulse deficit, paresthesia, and poikilothermia. Regarding the biological parameters or biological mechanisms, we shall have to know all these 4 things. Corticotomy, what is that? You know that. Low energy osteotomy with the preservation of periosteum, endosteum, and the bone marrow. And law of tension stress, that is the Ilizarov law. Slow and steady traction on a living tissue creates a stress which is metabolically activated and which stimulates histoneogenesis. And TTT, that is how we are going for that, tibial transverse transport, and of course destruction osteogenesis. These are the biological mechanisms. Now you can see when you are doing corticotomy, immediately you are reducing the intermedullary pressure. It improves microcirculation of all small vessels in the medullary cavity, improves arterial blood supply as well as venous drainage, pain relief, and raising the limb skin temperature within 24 hours after TTT surgery. Now, which is very important, that Professor Ilizarov has given that law of tension stress. Just now I told you, limb regeneration and functional reconstruction. The principle behind this, again, I'm going to repeat that. I would like to emphasize that tension is applied on living tissue. It promotes cell division and differentiation of adult stem cells, like that in the fetal tissues development, and lead to tissue regeneration. And Kurgan evidence suggests that TTT may mobilize stem cells systemically, spatially promoting recruitment and migration of mesenchymal stem cells towards the damaged tissues and mediating the local inflammatory process or response, which improves the local microenvironment to facilitate tissue repair or regeneration. And you know that distraction osteogenesis promotes capillary and vascular network regeneration, and bone transport technique can significantly improve the microcirculation and soft tissue wound healing. Now, I would like to tell you regarding the procedure. Look at this picture. If you see the right side, I have drawn a picture here. You can see here, this is your tibia. When you are going for osteotomy here, first of all, you make a small incision here, small, go for cut here, and then put the olive here, 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 and this is whole like, and further this is rectangular. This rectangular is going for that. I will elevate this one from medial to lateral side, putting the olive wires here, olive, 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 and olive wires here. So this is a diagonal scheme you can see here. Now, I would like to show you this one. First procedure. See, I have put the olive first, and below the olive, I am going for osteotomy, just making a small incision. You can see in the right side and in the left side, when you're putting the wires, then you can, as well as you should have to put the rubber stopper. And now you can see the right side, how I'm going for osteotomy after putting below the olive wires. This is the first procedure. You can see this one, and right side. And at the same time, you can control this whenever you have done the corticotomy in the right way. You can control this by your C arm. Just below the olive. Small incision. Now you can look here. From the medial to lateral side. Now you're cutting below the olive and go for rectangular transversely, just like this. This is the one procedure. Whenever you have put every wires, olive wires, then you can fix it with the long plate. You can see how we are fixing this with long plate. Then you can see this is with the long plate with the slotted bar. Slotted bar. This is the right side. Left side, you can see the when you are cutting, you are getting a little bit blood is coming from the wound. And see, this is the way left side, and this is the right side. You can see how we are fixing this one. So this is the way you can do. You can fix the Ilizarov 2 rings, one above, one below. And depending upon the case, you can put minimum 3 olive, 4 olive, or 5 olives. Here I have put 5 olives. And after putting that, you cut the wires, and then see, this is from medial to lateral side. From medial to lateral side, your first ring and second ring, and cutting all the wires. Now you can see your almost operation is finished here. This is, see, small incision with a small incision. I think probably it is very nicely visible. You can see here. In the Siam also you can see. And then your fixation is complete. You have mounted the apparatus, and you can see how nicely after putting the apparatus with well dressing, your leg will be like this. And this is the beauty of Ilizarov apparatus, minimally invasive surgery. Then see, this is case, dear friend. diabetic foot ulcer of a 32 years old male. Look at the same patient. Look at the dorsum and look at the plantar surface of the foot. And after primary dressing, I have done the dressing, lot of pus, and then well dressing was done. And then you can see here, this is in the right side, you can see, you make it drill second procedure. Right side, you make a small hole, with drill bit, you make a small drill with 2.2 mm K-wire. You just make the points, and that side you go the osteotomy. Longitudinally, you go for osteotomy. And then after doing the osteotomy, you see I have done the osteotomy, middle one. Video you can see, I have done the little just cast incision, and then put the olive wires below the osteotomy, olive wires. And this is the C first wire is going on, olive wire. So, and the right side you can see almost it is visible. Right side 1, 2, 3, or 4 we have put. So second one, when after cutting the bone, that below the bone you just put the olive wire so that you can lift up the segmented bone. So this is, you see, this is again what I am doing. You can see, just this is with hammering. Before hammering, I have, with the K-wire, I have made a small hole so that in the same line, by this way, you can do the osteotomy, and after doing the osteotomy, you can pull the olive wires accordingly. So I'm showing that so that you can understand easily what is happening here. Very small incision, and do the osteotomy, nothing to be worried, and you should have to go only meticulously. See, again osteotomy, you do here from the medial side, because you should have to lift up the bone from the medial to the lateral side. Sometimes you can do it from the medial to the lateral side also for bone widening. So next we can see here, you can see the final, of course the final way. See the second procedure, see the right side with the olive wires in the x-ray. And this is the final view just after second day after the post-operation. Look at the just leg, look of the leg, look the foot and the leg as well as, and the dressing, how we have dressed the full leg. So after the surgery, we allow the patient to go for Ilizarov methodology is for fundamental principle, load and motion. Look at the left side and the right side. Now I'd like to share some experience with TAO. That is, you can see, this is a disease of thromboangiitis, 44-year-old male, TO3 stage 3, lower extremities, sequelae are most prominent on the left side, permanent pain and major trophic ulcer over the left great toe. You can see here, we have done the pre-surgery angiogram, extreme degree of involvement, left anterior and posterior arteries are totally occluded at their proximal part. And then this is the, peripheral angiogram we have done before surgery, the condition of the lower extremity. And this is after the surgery, vascularity improved in the same limb after doing the surgery. Now, see the trophic ulcer of the left great toe. After 1.5 months, smiling patient, you can see chain smoker, the smiling, the ulcer is healed. Only 1.5 months. We have distracted for 21 days and kept it for 45 days. See, widening of the bone, and this is before, and this is after. See here, this one, so bad. This is the widening of the bone, and this is the final of the external view of the great toe. Same case, chain smoker, you can see. Same case, widening of the bone. And this is published in American Journal 2015. Now, diabetic foot ulcer. I talked about this. Morbidity and disability, the very important things, and mortality, socio-psychic cost is very important. And this is diabetic foot, long-term 4 years non-healing ulcer over the right medial region, 2.5 to 2.2 centimeter for 45 years old male. And he took a lot of antibiotics and came to my center. And then you can see, dear friends, here, I have put here the 1, 2, 3 olives, done the osteotomy, just the 2 procedures, anyone you can do. And then here I have put the only console wires from here to here, to the metatarsal bones. And then every day I have pulled these console wires up to the fast cortex, 1 millimeter per day. And this is also like that. And as a result, this is the healed ulcer you can see here. The space is coming here. You can see here. And this is the healed ulcer you can see here. And this is before, you can see, and this is after. This is miracle. This is magical, I should say. Look at this. They put in the wires. How we can do that? You just go like that, and then put your apparatus, Ilizarov, and gradually it stops. This is radiographic view. Now you can see the redness of the skin, and at the same time you pull the wires. So this is the healed ulcer. This is the beauty of Ilizarov. Technique, wire technique, how you can save the limb, and you can change the color of the skin. Diabetic foot, great toe, see here. Again, simple wires, and you can save the limb. This is a Charcot neuropathy, ankle joint. You can see she was suffering long time, and she had a trauma, and she was treated by another orthopedic surgeon like that. Now you can see the total joint is damaged. Charcot arthroneuropathy, and then came to my place. I did the surgery. Arthrodesis I have done with mini incision. You can see here from lateral side and from the anterior side, and they put the Ilizarov, fixed it one, because the bone quality is not good. With thin biocompatible olive wires and Ilizarov wires or K wires, you can get a very good, fantastic result. So this is the beauty. This is the arthrodesis. After, this is before, this is after, and patient can walk, and he could walk, she could walk normally, and this is the view of the front and the back. And this is also published in American Journal in 2018. Now, let us see the some limb ischemia. You can see, dear friends, look at the left side, non-union, and at the same time, discoloration of the skin. If you prescribe any kind of medicine, you cannot change the color of the skin. Trauma in the right lower femur with non-union and discharge in sinus. Then, what you did, see, normal Ilizarov, and see the wires here. These are the console wires. How the wire technique can improve from both these sides, from these sides and these sides, 4, 1, 2, 3, 4, 1, 2, 3, 4, where we have fixed console wires. And then we started pulling these console wires up to that cortex. And as a result, you can see the color of the skin already changed. Why? Because the circulation of the limb is increasing due to this method. And you can see before redness of the skin and non-union side union achieved, and you can compare the color of the skin from here to here. So this is the beauty of, again, the wire technique. So this is orthopedic proceedings, British Limb Reconstruction Society. They have published this one, and I presented this paper in June 14 in BLRS conference. So now, dear friend, I'd like to draw your attention regarding a very important mycetoma pedis, single case in the world. Probably, I don't know. I have seen the literature, I don't find anything. This gentleman, he is a cardiologist from Chittagong, our another district, came to my place before treatment. Look at this, 45 years old gentleman, mycetoma pedis. And see, he went to different countries for his skin testing. Even in Somalia, they have a problem. They have a center for testing this. And then he went to any European countries, then India and other surrounding South Asia countries, then came to my place, how to help regarding the ulcer. See, he came, his wife is a gynecologist, then I put the Ilizarov. Of course, I counsel him. His father-in-law is a well-known general surgeon in Chittagong. And then, see, look, with 3 volleys, I osteotomized here, you can see here. And then gradually started TTT. This is widening of the bone, and you can see good regenerate, ulcer healed. So this is the role of Ilizarov angiogenesis in accelerated healing of painful multi-drug resistant modular foot ulcer, a rare case report also published in 2019 in American Medgrave Journal. Now, I would like to show you some infected sole and dorsum of the foot. These are the varieties. Post-traumatic scar in right foot and infected sole and dorsum of the foot. See how to treat the Ilizarov. Again, same with multiple K wires and with TTT. Again, you can go for that. You can see what I have done. Of course, you need to go for skin grafting. Now you can see the left side, dorsum of the foot with the healed ulcer after 1 month of Ilizarov fixation. And the right side, you can see the radiographic view of the foot after application of the Ilizarov. So wire technique, dear friends, you can see. So these are the techniques you should have to apply in the leg and in the foot. And as a result, you can get a very good and fantastic result. So the Ilizarov apparatus, clinical appearance of the foot after 3 months, you can see and follow up. Now, this is a very interesting case. I'd like to show you. 18 times surgery was done, this gentleman from Somalia. You can see here. This is a very interesting case in my life. 2016, 5 operation in Uganda and Singapore, 1 operation in Germany, and then in Bangladesh. In total, 18 operations was done. Look at this very tall guy. Discharging sinus, non-union, and then came to my place. I put, very complex. If you look at this, those who are doing Ilizarov, they will understand. So I put the Ilizarov with multiple console wires. Only here you can see, only the top I put the shunts. Otherwise, everywhere I have put the Ilizarov. Now, wires. And then you can see here, wire technique of the femur. And then I started pulling. These are the console wears. And then showing regenerate bone. And he was so gloomy when he came to a place after doing the 18 surgeries in total. This is before, this is after showing good regenerate bone. Now see, gloomy face with a smiling face, tall guy. And very interesting case. Now everything is okay. Patient is happy. Of course, you are also happy. So this is another case, an interesting post-traumatic, sequelae of left knee dislocation, non-healing ulcer of the lateral border of the left foot with equinus and clot holes. You can see here, and then I'll proceed further. Very quickly, he was with this, came to my place with clot holes, and then I started doing, see the little toe, and he was advised to go for amputation. And then, see, before, smiling patient with healed ulcer. And in total results, you can see total case 165, relieved of pain 149, amputation done in 3 cases due to improper selection of the PBD. And almost all the patients benefited. Now, dear friends, regeneration by Ilizarov is an innovative medical technology that restores function by enabling body to repair, replace, and regenerate damaged, aging, or disease cells and tissues. TO, atherosclerosis, modular foot ulcer, diabetic foot ulcer, Charcot arthroneuropathy, masseter pedis, infected sole, dorsum of the foot, all gives magical Ilizarov compression destruction device. You can treat by this technique and you will get a very good outcome, excellent outcome. And we have a longest follow-up 20 years, shortest follow-up 1 year, complete relief from pain at rest, indefinite postponement of amputation, digital subtraction angiography routinely we have done before and after surgery, showed new vascular collateral network across the affected arteries that improved the circulatory status of the ischemic limb. And in my conclusion, the resultant new vascularization improved tissue perfusion and oxygenation. This is very important, leading to immediate and consistent relief from pain at rest. The TTT surgery should be performed with a minimally invasive fashion through small skin incisions, meticulous corticotomy, purposely designed Ilizarov fixator to ensure standard surgical procedure and post-operative management. The contributing factors for fair and poor results are continuation of the smoking. This is very important. And dear friends, I'd like to draw your attention regarding the long-term retention of the knowledge. If you tell me, I will forget. If you show me, I might remember. But if you involve me, I learn. This is very true. And these are my all mentors, Shepsov and Diachkov, very good Ilizarov surgeon, both sides in Kurgan Center. Love to see all these giant people. We had conducted the Ilizarov conference, and this is the Professor Ilizarov. I always love to show this. And, my center, they are doing all the time exercise with the Ilizarov apparatus. These are my published books since 2006, 7, 8 books. And within a short time, I'm going to publish a superior extremity of the human body. Thank you so much for your kind attention. And finally, I always show this evidence, science, and art, surgery and surgical skill of the surgeon. This is very true. Thank you so much again. Thank you again for your patient hearing.
Thank you very much. Thank you very much, sir, for your magnificent and magical presentation. I think this is a great innovation in the treatment of ischemic limb disease. I would like to request Professor Manish Dhawan, sir, to say something about the presentation and about the innovative treatment.
Excellent presentation, excellent. But what I'll tell you that it's a learning thing for me also. So, Dr. Bari, I want your opinion, your comment on two things. One is that how does the console wire work? Because they are just plain wires and there is no olive in that. So how does it work? And second question will be on Madra foot, which I'll take later on.
First, console wire. When you are putting the wire, drilling the bone through the wires, you are increasing circulation. This is the theory. And when every day, after 2 or 3 days, you started gradual distracting gradually, 1 millimeter per day, again also you are creating circulation. This is scientifically proved. This is the beauty of console wire. And when you are increasing circulation, in Ilizarov methodology, normally only not for this one, whenever you are doing corticotomy, 330% circulation you are increasing. That is shown by Professor Ilizarov and Shamsul also. So that is the console wire acting like that. Gradual distraction, you go from transverse way and from the vertical way. And then you gradually pull, you're increasing circulation. You have seen that I have shown you the color of the skin after doing that. Beautifully shown, because the circulation increased, that's why color of the skin changed.
Yeah.
Manish,
my second question
please.
is that, hello, can you hear me?
Yes.
Yes, sir, we can hear you. Yes, sir.
Yeah, my second question is that you showed me, I think it's probably I got this idea today from you that you can treat Madura mycosis by this, because I was not aware. Now
I was also not aware, but I have taken it as a challenge. Once I can treat the diabetic ulcer long time, very big gap, then I thought that to improve circulation, that is the principle of Ilizarov, then I started that. They agreed, the cardiologist, father-in-law is a well-known general surgeon. Then I did, and he's okay for the last 3 years. No problem.
Yeah, because last week I saw a case of Madura mycosis and I was so confused at what to do for him. Now my question is that with the Ilizarov therapy, Ilizarov treatment, what kind of medical therapy you have done for Madura mycosis?
They're getting the treatment for Madura foot. That is okay. I have done only the surgical intervention. The medicine, they are doing that one.
Medical treatment is also very important with this.
Yes, of course. Not only the surgery, medical treatment at the same time. For healing of the ulcer, you will go for surgery, this one. TTT.
Yeah, excellent presentation. Excellent.
Thank you, sir. Thank you. Thank you, sir, for your nice questions also. And now I would like to request Professor Indraduth Chunnoo, sir, to say something regarding the presentation of Professor Mofakhkharul Bari, sir.
Thank you very much. I'm very pleased to have listened and participated in this lecture. I have to congratulate Professor Mofakhkharul Bari for his long experience. He has written so many books. He has a great, large, vast knowledge, having worked in Ukraine, in Tashkent, in Kurgan, Siberia, and in his Ilizarov hospital in Dhaka. I'm greatly impressed by the work he has done. I know him very well. I've read his books. I'm reading his books as my second Bible. And I must say that the magic in all this is the osteotomy which is being done so precautiously. Dr. Bari said you must go just by little tap and don't cause necrosis to the bone. Little tap of the osteotomy or osteotome to cut the bone, but preserving the subperiosteum blood vessels. At the same time, we preserve the medullary canal. It's not like surgery in orthopedics that we go and ream the medullary canal. Here we preserve both the endometrium and the external blood vessels. Now, There's one word I'm going to mention which has never been said by anybody. When I was studying in Russia, in Moscow, the president Nikita Khrushchev once said, snatch from nature what nature offers. He declared this because they were growing maize and they wanted bigger maize with better quality. And this is snatching from nature. This is what Ilizarov has done. Ilizarov did osteotomy, very slowly started destruction. And he observed that destruction causes the proliferation of all tissues, the blood cells, the soft tissues, blood vessels, nerve tissues, and everything. And here, by the accordion, in and out, distraction and compression, he increased the blood supply, which is very important. And this is the principle applied in all the Ilizarov apparatus.
Thank you very much, sir. Thank you very much for sharing your knowledge. Now, I'd like to request Dr. Shamsul sir to say something regarding this magnificent presentation.
Thank you, Bari sir, for a wonderful lecture. I really learned a lot from this lecture. I've been using Ilizarov in different deformities and infections, but I've never used in diabetic foot ulcers and ischemic limb diseases. So this is a real wonderful learning, using Ilizarov method in enhancing blood supply and circulation and the capacity of regeneration in these cases. Thank you, sir. Thanks a lot,
sir. Thank you very much, sir, for your excellent presentation. Sir, I have a question. You were doing the osteotomy just below the olive. You were cutting the bones through and through for the fourth cortex or for the third cortex, up to third cortex?
Two procedure I have showed you. First one, you go just put the olive, small incision, and below the olive, you cut the first olive, okay? Osteotomy. You osteotomize the below the olive, below the first olive. Then from first olive, you go a little bit below. Don't cut the long, don't make a long incision. If you make a long incision, you are inviting the osteomyelitis in the whole limb. Sometimes it happens, somebody is doing that. If you make a long incision, you may invite a osteomyelitis, bone splinter. That bone may become dead bone. So it is better to do, when you put the first olive, you do a below the olive, do a osteotomy, make incision, and go straight away a little bit. Your osteotomy size is very small, 5 mm. And then you go to the second olive. Again, you put the osteotome below the olive, do the osteotomy, and from first olive to second olive, the first olive, you try whether you have done osteotomy in proper way or not. And then second to third olive, again, you do the osteotomy. From third to second olive, you again see you have done the osteotomy or not. And at the same time, you can control in your lateral view of the C-arm. AP view will not be able to understand. And whenever you are doing this surgery, if you are a little bit intelligent, if you have experience, you could identify with your finger that, yes, I have done the osteotomy. Then you fixed it with your long plate with slotted bar, and then you can pull to the table a little bit. You're sure you're okay. Then you stop. 3 or 4, 5, 6 days you can stop. Then you can go for distraction. 3, 4, 5 maximum. Then you start distraction. Even I tell you, dear friend, you can try yourself. You take this with your poor patient. As soon as you do this, you will make sure your increases circulation and swelling will subside, especially in case of diabetic patients, swelling of the ankle and foot. Then and there it will subside. And I have seen a lot of patients, sir, I am taking a lot of times all kinds of Dazide. This diuretic I am taking, swelling is not subside, but after doing surgery, I have no swelling. And skin, you know, shrinking like this. This is the beauty of, because you are increasing circulation in the whole limb. Okay, clear? This is your.
Okay. Yes, yes, sir. Yes, sir. That's clear. Thank
That's
you
why
very much, sir.
I told you, if I tell you, you will forget. If I,
So yeah. So
if
doing
I,
minimally, yeah. Please, sir.
if I tell you, you will forget. Second, if I show you, you might remember. If you involve me, if I involve you, you'll learn something. Involve,
Yes, sir.
that's why you have to see. Then you learn forever. These are the
Right,
three
sir.
things.
Right. So,
That's
sir,
right.
with this minimally invasive incisions, you connect the whole ostomy this way, sir.
Yes.
Right, sir. Right.
Whole. Rectangular. Then top and below a little bit rectangular. Gradual lift up. Okay.
Right, sir. Correct, sir.
That's
Thank you.
great,
Thank
sir.
you,
That's great.
Indra.
Thank you.
Chandrajit, my dear great man, Chunnoo, he's my very good beloved. He's doing a lot of Ilizarov in Mauritius, and all my good friends. Good to see you here, that you are here.
One word.
Okay.
Thank
One word.
Yes, sir.
Can I say?
Please, sir. Please.
Yes,
Yes, sir.
yes.
Please.
Yeah, Professor Bari, you are the honored professor at Kurgan. And I'm pleased to say that as a foreigner from Mauritius, I went to study in the Soviet Union in 1963 to 69. 63 to 69. After
Too
that,
much.
and worked for 3 years in surgery, gynecology, medicine, and everything. And then I got another second scholarship, government scholarship to study orthopedics. So when I went there, from 73 to 76, I studied orthopedic surgery at the 4th City Hospital and at the Central Institute of Traumatology Orthopedics, and where I have met Professor Aganisyan. And I'm pleased to see that Professor Bari too had a photography with Professor Aganisyan, who gave me his apparatus. It was called hinge apparatus. That is, you can fix both long bones and intra-articular bones, but at the same time, there is a hinge to make some movements. And probably this comes in today. This has increased the blood supply around the joints, around the bone, fractured bones, and at the same time reducing edema and swelling. This is what Professor has been said. So I was the first orthopedic surgeon as a foreigner outside Russia to have introduced this Ilizarov external fixator in Mauritius in 76.
That's
45
good.
years back. So thank you. I have to congratulate you, Professor, for carrying this work, marvelous work of Professor Ilizarov.
Yes.
Thank you. Thank you very much, sir. It's a great honor for us to speak with you, and definitely we'll be glad if you join with us in our next program also. And dear viewers, we hope, we can learn from sharing our knowledge, and definitely the ischemic disease in the lower limb, it can be treated by Ilizarov, and this is a very innovative treatment. I hope we'll practice in our coming days, and we will improve this technique, and definitely we will follow our Professor Mofakhkharul Bari sir, a very innovative and magnificent Ilizarov surgeon in Bangladesh. I would like to give a salute to Professor Mofakhkharul Bari sir for introducing this type of treatment uh, to us, and definitely for showing the evidence-based treatment to us. Dear viewers, I want to say bye-bye today, as because of the time is out now, and hope we'll see you in the next Friday with another magnificent topic. Until then, I would like to say bye-bye. And I'm Dr. Tanvir Ashraf. I would like to thank Raj TV and definitely the Renato Pharmaceuticals Limited for sponsoring our program, and definitely our honorable academic panels for being with us. Okay, have a safe life and have a safe day. Bye-bye.
You are watching Raj TV.